In this video, I want to talk to you about what is runner's knee.
Don't forget, if you like our content and you want to see more from us and more videos to help with your health and well-being, make sure you subscribe to our channel and hit the bell so that we can notify you as soon as we launch any new content.
So before we get into the real content of this video, what I wanted to explain that this is quite an in-depth topic. So what I've done is I've produced a webinar all around runner's knee, giving you some more detailed information. And I also answer one of the most common questions that I get asked, which is running bad for your knees? So feel free to check out the link below where you can get some more detailed information within the webinar. So, runner's knee, what is it? Well, runner's knee is really a collective term that we use and can be applied to a few different injuries. So, for example, here in the UK, we tend to attribute runner's knee to what we term ITB friction syndrome. But I also see it being used as a term that can be applied to patellar tendonitis or patellofemoral syndrome, which is particularly when I see American research, that might be how they use runner's knee. But why do we call it runner's knee? Well, quite simply, these two conditions are so common and we see so much of it in clinic and we can attribute it to running. So that's why it's got its own phrase as runner's knee. But what I wanted you to understand is that really it can be around any of these two conditions in the knee, and in clinic we see them at about 50-50%. So what are these conditions and what is runner's knee? Well, if I start with ITB friction syndrome, as I say, this is what in the UK we class as runner's knee. So first of all, what we want to understand is what is this ITB? As a runner, it's quite an important structure that we really understand the truth about this iliotibial band. Now, the ITB is a piece of fascia. So what's fascia? Well, fascia is connective tissue that surrounds our muscle. I often describe muscle as being like an onion in that we have the bulk of the onion, which is our muscle. We have a skin around an onion, which is our skin around the body. But also in an onion, there's that plasticky layer inside the skin. And that's what we have around our muscle, this fascia. And this is all around our body, connecting our body. But we do have thicker areas of this fascia, and as a result, sometimes can be more problematic. And probably the most problematic is the ITB. So the ITB runs from the hip and it comes down and attaches into the outside of the knee. So what we can experience with this runner's knee pain is that as we're running, we start to feel a pulling sensation in the outside of the knee, almost can be like a stabbing sensation if it becomes particularly bad. And that is because this iliotibial band, which we're pulling on repetitively with every step, is pulling at its attachment point at the knee and is causing a discomfort there. So it's the iliotibial band's fault. Well, yes, but let me expand on that a little bit more. The iliotibial band, or fascia in general, is a bit of a dumb structure really. It doesn't have the properties of muscles, it doesn't have the receptors of muscles, and as a result we're not able to stretch it or really change much about its structure. This sometimes can be debated, but ultimately what we find is this ITB in particular is very thick, and so we're not able to really change that. But what we can affect are the structures that are pulling on that knee and pulling on that ITB. Now, when we want to correct an injury, I often describe this as trying to fix a leak. If you had a leak at home, you could, and the water was coming through the ceiling, for example, you could just put something to block that leak and that would stop the water for a period of time. But we would know that that is not correcting the problem. Once the rain comes back, the water will come through and the problem will still be there. And that's how we look at injury. We could just treat the knee, the area that is sore, but if we don't actually trace that back and find the cause, as soon as we go back to running, the problem's going to return. So where do we look to trace this to? Well, when we're rehabbing from injury, we tend to look above the joint and below the joint. When it comes to runner's knee, the first place we always start is above the joint. That's at the hip, because the hip has two sets of muscles, the glutes and your TFL muscle, which attach into the iliotibial band. They pull on that iliotibial band. So if we have an issue at the hip, that will pull on that iliotibial band, which will pull on the outside of the knee and create runner's knee. So in order to cure this knee, we may well need to get into work on the hip. And as I say, I discussed this more in the webinar, but what you want to be doing is assessing the flexibility of the hip, assessing the tissue structure of the hip, whether there's trigger points and adhesions that could be creating extra force, and how strong are you at the hip. We can then look below, so at the ankle joint, and the same principles apply. Have we got the correct amount of movement at the ankle? Have we got the correct amount of strength at the ankle so that the knee isn't being beaten up, which is what's happening in this scenario? Now, as I mentioned, another condition that can be classed as runner's knee or is classed as runner's knee is the patella tendon issues or patellofemoral issues. So what this is really is the looking at the patella tendon, the structure that runs over the top of the patella, which is your kneecap. Now, a tendon attaches a muscle to a bone to allow the muscle to create the movement that it wants to. So in this case of the patella tendon, this is the tendon of the quad muscles, the four big muscles that we use a lot in running. I'm sure we've all got back from a run and felt a deep quad burn, and that's because we're using those muscles a lot. Now, what can happen is that if we have something that is creating extra force on the knee, and this is quite commonly the quad, so if we have a lack of flexibility or a lack of strength and adhesions in the tissue, it can start to cause a problem at that knee. That once we start running, that really compounds those problems and we feel the problem at the knee. But again, it could well be above. I keep mentioning it, but in the webinar, we discuss this in a little bit more detail because it could also be some other contributing factors all around the hip and really any muscles that are affecting or crossing the knee. But the same principles apply that we then want to look below as well. Have we got those correct amount of movement at the ankle? So with runner's knee, should you be running? Well, runner's knee, whichever condition we're looking at, is a overuse condition. Now, what I mean by that is we have acute injuries and overuse injuries. Acute injuries are injuries where we do something and we get pain instantly. So this might be walking along, you trip down a curb and you sprain your ankle. That's an acute injury. When we're talking runner's knee, we're talking overuse conditions, doing something slightly wrong over a period of time, creating poor biomechanics, which is creating these issues. So what I mean by that is pain is there for a reason. So if you are getting pain around that knee when you're running, you are running too far and you are causing yourself further damage. So what we want to be doing is modifying our exercises, reducing the mileage to the point where we're able to run without pain. But whilst we're doing that, we want to be cross-training or doing other things that can help us out. So this might be non-weight bearing running, but non-weight bearing exercise, so exercises like swimming. But ultimately, what we want to be doing is finding the problem and correcting the problem and then progressing ourselves back into running. That's the true way to overcome runner's knee. However, in this short video, I've tried to give an introduction into runner's knee. What I wanted to do was put more detail, more research, more explanations in our webinar, which I'll link to in this video. So I encourage you to go and check that out, and I look forward to receiving any of your comments and thoughts.